Dr. Choll came here from sunny San Diego, California. Again, everything but the kitchen sink to take care of this really awesome gentleman from up north. He's also really, really big, and he's got a very interesting disc herniation. It is a multifocal disc herniation. His main pain is on the left side, but he's got a tri-lobed disc herniation. The right side is just numb and tingly. It started out with pain, but he's starting to get some symptoms. But his main symptom is still on the left side. So I'm going to come in on the left side transforaminally, utilizing the most minimally invasive technique that I know of, the less procedure, and take out as much of the disc as possible. If I can't get to this side, I will probably do a bilateral approach. It's a little cumbersome, but we got to do what we got to do to get him back to living life to the fullest extent possible, because let's face it, life is short. So wish me luck. Okay, we're getting started. I drew the perfect entry point, confirmed it with the needle, made the appropriate adjustments before I made the incision, and now I'm taking the spaghetti noodle dilator and utilizing delicate Asian fingers. I'm going to advance it to the surgical target site. Shot. Ooh, I like that long old time. Okay, I've got the spaghetti noodle dilator right at the working triangle. Got my pinky out. Now I'm putting this skinny little needle.
All five left, right.
Oh, whatever, Ali. No, I'm kidding. That's his job. That's Dr. Asimov, neurophysiologist extraordinaire. Shot and save. Telling me that the nerves are working. Shot and save. That disc is kaka-poo-poo, because it should look like a hamburger. 2 buns in a patty. Shot and save.
All five left,
It's very, everything's so irritable. You can already see it leaking out the back there. Shot and save. Okie dokie. Oh, it's like butter.
Train of small activities and left tibialis anterior.
That tells me that your nerves are really irritable, because I'm barely doing anything and your nerves are firing. Your leg isn't jumping, but the neuromonitoring is picking up a lot of activity. And I anticipate that at the end of the case, the sensitivity of the nerves, on neuromonitoring anyway, is going to get much quieter. That's my hope, expectation, anticipation, desire, and wish. Okay, here's the absolute first look. You can just immediately see all this blue. And you can see all this cockapoo that I got to get out, but that's part of the job. And there's the disc right there. How cool is that? You can get close enough to see almost like sometimes red blood cells going through the capillaries. That is the most wildest thing. Okay, so here's the neuroforamen. There's the disc. It's totally incompetent. And look how much red blood vessels there are. That's a sign of inflammation. And the other sign will be adhesions. And I should be able to just slide in here normally, but it's all stuck right here. So I'm going to work all this until I can pass the probe easily without impediment into the canal, and I need to be able to get all the way to the other side. If I can't, then I'm going to walk over to the other side and do a bilateral approach. Alone, by myself, in the dark, in waist-deep snow, barefoot, uphill, both ways, in the dark, without shoes. Sci-fi home laser. Look at that little red light right there. That's the aiming laser. It's not the actual laser. And look at how the tissue just disappears. It's so magical. Doesn't char or burn. And it does not conduct electrically, because it's all mechanical forces. So I can literally work right next to the nerve if need be. That's my story. I'm sticking to it. Okay, so all that red stuff is the canal. And look at all that blue stuff right underneath, exactly where it's supposed to be. Canal. Now I can kind of get into it. Yep. And then all this right here needs to go. All this stuff inside here. Look how close you can get to it and see. It's wild. You can never get this close. Mini open. Okay, here's the Viagra. The ball tip feeler, curved. Don't ask me why we call it the Viagra. We just do, okay? There's the canal.
Small spine, left vastus lateralis.
Oh, by the way, have you noticed how quiet it's been? Besides what he just said? It's before everything I do, if I even looked at this area, it would fire. Now,
Small spine, left
I have to,
lateralis.
I feel a bump right there, there,
Large spine, vastus lateralis.
there, and that's clear right there. And that should be the pedicle. That's Wagner's arch right there. X-ray should be curling around the pedicle. Just like that. Now I know exactly, precisely where I am in three-dimensional space, and I just need to get some work done now. That's most of the surgery, knowing where you are. And even after 1,000 cases, it can be confusing. So I don't take anything for granted. Yes, I'm a nervous Nelly. Okay, look at the X-ray on the left. The curette, this articulating curette that I have in the, is all the way to the other side. So I'm pretty sure I'm going to be able to get everything from here, but we'll see. Okay. Oh, what a tease. But there's a big piece right there. How cool it would be if it just came out in one huge piece, like a clog, like that hair clog in your drain that you pull out with a little snaky thing. That would be so satisfying. I have the curlicue pituitary. It's a curved grasper. So I'm reaching across and up. See how it's curved? Look at that. Oh, there's something right there. Aha! But it's like my teenage kids, it's not going to come out without a fight. Tooth. Another custom instrument, because you know what? I'm like a professional golfer. I don't play with clubs off the shelf. Every club is customized to me. That's not really true. When I play golf, I just play with over-the-shelf clubs, and I've never actually bought a club in my entire life. All my clubs have been given to me by somebody. I'm a total golf mooch, but not when it comes to surgery. When it comes to surgery, everything is absolutely optimized. And I have a lot of custom instruments, just like any professional athlete. So the snaggle tooth hopefully snags loose pieces of disc. I'm just backing it out right here. There's something right there. I just don't want to rip it out because delicate Asian fingers and such. Hard to tell because the videos, the x-rays are so washed out, but you can see how far across I am.
Yep.
All the way to the left side, so I'm feeling good.
Yep.
I just got a lot of work to do. Look at all this stuff that's got to go. These articulating instruments are the key to solving so many problems with endoscopic surgery. Don't tell my competition, though. It's my little trade secret. Hopefully they won't watch my YouTube videos. Because anybody can watch them and just go, I'll just do that. I could not pass my instrument easily. Underneath here, look at that, it goes all the way across. Shot. That's to the midline. Shot. After all I've done for him, I can't believe him. Right there, see that? There's Wagner's arch. This is the part of the surgery where most spine surgeons just get unbelievably anxious and impatient and irritable. Don't ask me how I know that, I just do, okay? This is the tedious part where you're getting all the pieces out. Just want to rip this open and just reach in there and grab everything, but no, then it wouldn't be so MIS, would it? But this is going well. I'm really focusing on the right side now. X-ray. Yep. There's something right there. Like it. That's exactly where I want to get to. I want to get to the medial border of the pedicle.
Tiny train of spines right tibialis.
Oh, you and your tiny trains. It's so quiet now. I'm in the disc more, almost halfway across. So I'm really like a submarine now. And then look at that thing right there. It's like the tip of the submerged end of the iceberg. Not this one I'm working on, right above it, right there. Right up there. I'm just exposing it better so I can really get a good look at it. Okay, so I've reached all the way in and all the way to the other side. So I do not have to go to the other side, which is great because it is another opportunity to endanger the nerve. And if it's not necessary, then it's best not to mess around. I still need to quadruple check that everything's okay from this side. But I am liking that long old time. All done. I backed up a little bit to just clear up the edges. I reached all the way underneath here to the other side. This side is totally clear now. Surgery's all done. It went so well. I did it all from one side. It was a lot of work though, so I hope you appreciate the effort, because having to go to the other side just endangers the other nerve root. But look how cute that is. Look how cute this is. The surgery went beautifully. I'm expecting you to have an awesome result and a speedy recovery. We're all praying for you, right guys?